In December, 1 year after the anti-Balaka attack on Bangui, the French Defence Minister announced the partial withdrawal of French peacekeeping force Sangaris, considering that their job was done, despite the regular outbreaks of violence.
Chaque fois qu'il y a une tentative de remettre des préfets, des gendarmes, des policiers en place,
all attempts to reinstate state representatives or a police force fail because the requisite security conditions have not been met. The main armed groups don't accept these state representatives, and so parallel administrations have been set up.
Des administrations parallèles qui sont mises en place. Et là-dessus, les interventions.
The international armed force steps in to contain the fighting. But politically, no order has been instituted, and there's still no sign of the Central African state resuming its role.
Politiquement, il n'y a pas un ordre qui est en train de se remettre en place. Il n'y a pas un État centrafricain qui est en train de reprendre une place aujourd'hui.
The economy is at a standstill. There's no education, and the healthcare system has all but collapsed. People are traumatized. Substituting for a state in disarray, aid organisations are doing their best to provide Central Africans with the services they so badly need.
Toute l'exposition à la violence que subit la population.
Aid organisations face the same violence as the Central African people.
Sur le terrain, les subissent aussi. On a eu plus de 100 incidents.
Our 5 MSF sections have been subjected to over 100 security incidents this year. Some extremely serious: rapes, hold-ups, murders, threats, just about everything, in fact.
The chief health issue is malaria. In 2014, MSF teams provided over 600,000 consultations for this disease alone. But in areas of the country without aid organisations, the all too few medical facilities are struggling to obtain drugs. And in many places, sick children have almost no access to healthcare. Monrovia has just 2 public hospitals, and like many other medical facilities, one of them, JDJ, closed at the height of the Ebola epidemic. But activities at the hospital, which delivers emergency paediatric and maternity care, are gradually resuming. MSF is helping by supplying protective equipment and providing training on infection control measures.
The measures are put in place. I think they're really going to improve our general condition in the hospitals. We're going to feel more confident. It will improve the kind of services that we give to these people, because one mistake will lead to your own death. So you have to be careful about what you do. But the most important thing is that I hope that it can be sustainable, that even after the outbreak we should continue with these measures.
These measures require stringent triage of incoming patients to rapidly identify potential Ebola cases, wearing protective clothing adapted to the treatment being delivered, and complying with rigorous hygiene protocols. All these measures call for a radical change in behaviour, which can be difficult to implement when the epidemic appears to be abating.
Even health workers, some of them are letting their guards down. They think that they don't have a lot of cases around, but there's a need for us to know that one case remains an epidemic, so that people should continue to have all those preventive measures in place so that people cannot get reinfected and then start the cycle all over again.
Along with assisting the resumption in medical activities, MSF teams continue to be actively involved in combating hemorrhagic fever. Oxford University launched a clinical trial at the beginning of January at Elwa 3, MSF's Ebola treatment centre in Monrovia, to assess the efficacy and tolerance of antiviral drug brinzodofovir. All patients contracting the virus can participate.
Parmi les services de l'hôpital, on a un service qui s'occupe exceptionnellement.
One of the services we provide at the hospital is assisting victims of sexual violence.
La prévention contre le VIH/SIDA.
In terms of treatment, first there's post-exposure HIV/AIDS prophylaxis. We also treat sexually transmitted infections and prescribe the morning after pill, which is a contraceptive. We offer immunisation against hepatitis B and tetanus, and psychological support to people who need it.
La grande préoccupation des mamans, c'est surtout les champs. elles doivent aller au champ.
One of these women's biggest concerns is being able to go to the fields to get food. But armed gangs lie in wait and sexually assault them. And they're also assaulted when these gangs loot their homes.
Mais aussi, elles peuvent subir des violences sexuelles au niveau de leur habitation. Lorsque les groupes armés viennent pour piller les maisons.
We've had the impression recently that many women are downplaying the situation. If they're raped once and then again, the third time they often don't seek medical attention. They say, no, it happens. How many times am I going to see the doctor?
Disent non, c'est devenu une habitude, mais je vais consulter combien de fois.
We broadcast radio messages and go to the schools and churches to reach out to them, raise awareness, to encourage them to come for treatment.
Pour sensibiliser, pour les inciter à venir pour bénéficier de tous les traitements.
Baluchistan province in southeast Pakistan ranks among the highest for child malnutrition. Situated in one of the country's poorest regions, food insecurity, lack of healthcare, and the fact that mothers do not breastfeed their newborns, which makes them more vulnerable to infection, contribute to the high levels of infant mortality. MSF teams provide medical assistance to mothers and babies in Deramur Jamali in the east of the province.
जी बात जो है MSF वालों लोग हैं यहाँ पर बच्चों की केयर हो रही है डायरिया के और ग़िज़ा की कमज़ोरी के
Babies get medicine and food here, but when they are discharged, they go back to their villages where living conditions remain the same.
जब यहाँ पर बच्चा रहता है तो ठीक-ठाक होता है फिर जब गांव में
To solve these issues, we need clean water so that we can have clean, safe food.
को हल करने के लिए सबसे पहले यहाँ पर पानी के साफ प्लांट लगाए जाएं जो पानी साफ मिलेगा तो ज़ाहिर है जो ग़िज़ा साफ मिलेगी.
The medical teams are aware that many mothers work in the fields right up until they start labour and return just a few hours after giving birth. Many to premature babies who are weak and often end up back in hospital in critical condition barely a month later. Since opening in 2010, MSF's programme has treated close to 40,000 children.